Good afternoon, North Dakota. Thanks for tuning in to the Friday afternoon press briefing as we head into Mother's Day weekend. And Mother's Day, always a special time for all the mothers, all the stepmothers, the grandmothers, the great-grandmothers, and always a special day in our family. Another personal shout out to our eldest, Joe Burgum, who was born on Mother's Day 27 years ago on May 9th, 1993. So his birthday will be tomorrow, missed Mother's Day this year. But all the mothers out there, happy Mother's Day weekend. This afternoon, or earlier today, the North Dakota Department of Health confirmed 54 additional cases of the novel coronavirus disease, COVID-19, out of 1,634 tests. 54 over 1,634, 3.3 positive rate. Sadly, we must also report, again, 2 additional deaths of individuals who passed with COVID-19, resulting in a total now of 33 North Dakotans who've passed away with COVID-19. Today, I was reporting a man in his 80s from Grand Forks County, a woman in her 80s from Cass County. Both had underlying health conditions, and as always, from the First Lady and myself, our hearts go out to all of their loved ones and the loved ones of all those who've lost someone during this pandemic. Yesterday, today's numbers relate to the 24-hour period for Thursday. We did not have a press conference yesterday. So on the day Wednesday, which would have been reported Thursday at 11 a.m., we had 49 additional cases out of 2,235 completed tests and no deaths reported yesterday. So that brings a total, we add in the Thursday report and the Friday report to 42,501 tests. Total of those, 1,425 positive. You divide those two and you get 3.4 cumulative rate since the beginning of that. At the 3.4% in the lower right of that slide, that remains the 5th lowest rate in the country, behind Alaska, Hawaii, West Virginia, and our neighbor Montana. On the testing standpoint, again, North Dakota continues to climb, rising to the 3rd in the nation in per capita testing, now only following Rhode Island and New York. And of course, those are two states that have been in the middle of the epicenter of the biggest outbreak, at least in the U.S. and I guess now in the world, in that New York City metro area. Why this matters and why we pay a lot of attention to whether or not these two numbers we always lead with, which is our testing and where do we rank versus other states, and our positive rate, because of course those are two things that are guiding us as we through this entire storm, and it continues to guide us as we do our North Dakota Smart Restart reopenings. Yesterday there was a study by the Harvard Global Institute, and they indicated that North Dakota was, in their view, one of 9 states that were ready to safely reopen. What criteria were they looking at? They were looking at how much testing the state is doing on a per capita basis, and they were also looking at the percent positive. According to that study, the minimum number of tests that should be completed in North Dakota by May 15th would be 913, and as everybody knows that watches these reports, we've now been able to top over 2,000 tests a day on many days, and continue to move in that direction to have that number even climb. They were suggesting that a state should have below a 7-day positive test rate below 10%. Our 7-day positive test rate is 2.3%. And so we're in great shape relative to even how others might be looking at us. But of course, we're making our own decisions here in North Dakota based on our own data, but wanted people to underscore the great work that everybody's doing on our testing teams, the providers, the labs, and everyone to make sure that we're continue to do a lot of high quality testing. And also we're doing that in a targeted way, not in a broad way, but in a targeted way. So again, even more impressive that our positive rate remains so low. When we take a look at the net case breakdown in terms of active cases versus recovered, today is a highlight day because this is a day we have been waiting for the first time since we've begun reporting this. We have more people in North Dakota who've recovered than are currently active. We have 33 hospitalized, which is I think down 1 from yesterday and similar to numbers earlier in the week, but there are puts and takes, if you will, or pluses and minuses, so it's not the same 33 people, but the overall capacity hospitalized, and only about a quarter of those are in ICU, and so we do have still enormous hospital capacity left in North Dakota, which is, again, credit to all of our teams and the providers for all the great work doing on the front end of this pandemic to make sure that we had that capacity. And sadly, again, still we have 33 total North Dakotans who've passed away. When we take a look at the North Dakota case trends, you can see more clearly that part of the reason why we had a drop in number of actives was because we had a record number of newly recovered. 113 individuals were designated and entered yesterday as recovered. And I'm sure that some of this relates to the data that's flowing through the system, and some of this would have related to several weeks ago when we had the large outbreak in Grand Forks. A lot of those were folks that were younger in age, working actively in manufacturing, and happily, those are all seeing recovery and coming back, but as those come through the system, we actually see a drop in the top line of number of cases. And again, well, people may, again, have a tendency to say that somehow that maybe there was that this was taken too seriously. We want to remind people that we're so fortunate to be in North Dakota and so much gratitude to be here, because with the total number of cases that we have reported here in the state, 1,425 cumulative cases, there are 12 states in the nation that have more deaths, people dying with COVID, than we have had, than we've had just cases itself, and including, I mean, New York now has passed 26,000 deaths from COVID, and many of the other surrounding states are in the 5, 6, 7,000 deaths per state. Minnesota right next door at 534 deaths, with 434 of those being in long-term or assisted living. In North Dakota, of the 23 of our 33 deaths have been in long-term care facilities, and we continue through our vulnerable protection plan that we're working on, the VP3 that we've talked about, are continuing to make sure that we can secure those facilities and keep them safe for all those that are living there. When we take a look at the positive rate and its decline, this is something we've been showing every day. It is one of the White House gating factors. Today's rate drops all the way down to 2.8%. It's down significantly from our high point of 6.4 just back on April 24th. We're going to see this line will continue to flatten off a little bit when we replace a day at the beginning of that 14-day average over the next 5 days, when some of those 6% days drop off and we add hopefully lower days in, we should see it drop off. But one of the things that we know that we're doing across the state is getting even more targeted in who we're testing, because again, we want to keep doing surveillance testing broadly. When we had some of those really large testing events, the drive-through testing events, we know that we had a lot of folks that might have shown up that would fall into the nervous well category. They had no symptoms and were nervous and were tested, and so that probably increased some of our negative rate. But as we find positives, do the contact tracing, identify people who've been exposed to them, make sure that those individuals get tested, and then when we come up with positives, make sure those are isolating. So that's our 3 things we're trying to do every day: test, trace, isolate. If we can keep doing that, we may have a period of time when we're actually seeing our percent of positive testing going up slightly, because we're going to actually really focusing our testing on people who may have been exposed. But we're really pleased at the direction that this is going. But again, we won't be alarmed if we see these numbers start to climb up on the daily rate a little bit again, because of the focused work we're doing. From a testing update related to the Red River Valley Task Force, this is something that we announced on Wednesday, and joining us by video were Mayor Mahoney, Mayor Dardis, and Chairman Chad Peterson from the Cass County Commission. We pulled that group together, and this was to, again, to amplify the combined efforts of the state and local resources against an area where we continue to see a lot of activity in the Red River Valley. We had 54 new positives reported today. 50 of the 54 cases reported today came from either Fargo or Grand Forks. 43 from either Cass or Grand Forks. 43 came from Cass County, and 7 came from Grand Forks County. So again, this just affirms the testing results of yesterday and today, affirms the need for us to have a more focused task force in the Red River Valley, and they're off to a great start. That task force has met. They've created subgroups consisting of public health and physician advisors. They're developing detailed local testing strategies. They're going to be supported by local medical providers and ample amounts of state resources to try to arrest this and slow the spread of the virus in that metro area, starting with the Fargo, Moorhead, West Fargo metro area. We have also, since Wednesday, we're pleased to announce and would welcome Mayor Judd of Moorhead, Minnesota, and representatives from the Minnesota Department of Health and Clay County Public Health. They've also joined the task force to make sure that we got a seamless approach to drive down the COVID-19 positivity rate in the Fargo, Moorhead, West Fargo metro area. The goal right now in the Cass County is, or not the goal, the current rate in Cass County is 8.3%. That's more than double the 3.3% of today, or the number, the 3.4% of what we've had cumulative across the whole state. The goal of this task force is to get this county rate down to the same positivity rate, to get it down to equal or less than the state average. This strategy, it will continue to be fine-tuned throughout the weekend, but a major focus, of course, will be on long-term care facilities and other congregate housing and other vulnerable populations. And again, we will be driving more resources to help this, because this is an area where we've got some of our highest positivity rates. We've got our highest number of actives to do that. We also, again, we've got really pleased that we've had a breakthrough already in reaching out to our neighbors to the east in Minnesota, but we've put together a collaboration, Sanford and Fargo, North Dakota Department of Health, and all of our team here, including National Guard members and others, collaborating with Clay County long-term health facilities, the state of Minnesota, Mayo Clinic, which has got a testing lab, and our own contact tracing team that we're going to combine together to work on getting the same kind of testing we've been doing in North Dakota going in Clay County in terms of testing all staff and all residents. And starting with one large facility in Clay County. But again, thanks and a shout out to Sanford Fargo for providing the personnel to help collect those tests, and thanks to the Red River Valley Task Force and all the leadership here in putting this together. Thanks for Moorhead and Clay County and joining us. Thanks for Mayo for stepping up on the testing. And again, we've offered the state of North Dakota, because we've got some contact tracing capability, that we would have offered to do the contact tracing of any positives that may come from that work in those facilities in Clay County. Understanding, though, that if there are hundreds of staff working at a Clay County long-term care facility, it's very likely that a percentage of those, and perhaps even a significant percentage of those staff folks, actually reside and live in North Dakota. So we'll work on the reporting on this to make sure that there's transparency so that everybody can understand on these cross-border operations where we've got addresses of people in both states. Also, we talked earlier this week about establishing daily testing at the Family Health Care Clinic. That will begin next week, and look for details from Family Health Care Clinic in terms of how they're going to manage that to protect their own staff and do that. And again, like all providers, if you're someone who wants to get a test, call your provider before walking in to make sure that you understand the arrangements and whether they're going to do that in a nearby new facility or adjacent to make sure they've got isolation and separation of those potential positives from their clinic to keep their clinic safe. But again, call them, but we're grateful to the Family Healthcare Clinic and all they do to serve their patients in Fargo. So thank you for joining in the fight. Next week, task force will begin executing this focused testing strategy, address resource needs, and they'll also define a menu of wraparound services as well, because in some cases, in some of the populations, we need to provide extra support for them if they have to be isolated going forward. Next update has to do with Battelle, and Battelle is a organization, Battelle Memorial Institute. Some of you may have heard of it. Started in 1926 in Ohio. It's a nonprofit. They do a lot of fantastic things. They're a large organization with over 3,000 employees, but they've been involved in this fight as well. They have, as part of a research institute, they have come up with a capability to do mobile containerized decontamination systems for PPE, particular decontaminating N95 masks. So we really are excited about this. When we took a look at we'll describe the system and then I'll tie it back to our restart in a second. But when we take a look at what you're seeing here, these are already installed. This is a picture from a warehouse here in Bismarck. These are containerized systems that show up and get set up and are getting run. They're getting set up to run. This comes through the funding comes through the Defense Logistics Agency, U.S. Department of Health and Human Services, and FEMA. And again, there was concern about N95 respirators, N95 masks. There's no cost of this system to the state of North Dakota, so that's also, I guess, would fit in the good news piece. There are 60 of these systems being distributed nationwide. North Dakota requested one from FEMA on April 15th. We're the 26th state to receive one. And so they're about halfway through setting these up. We're pleased to have been on the list this early. The Battelle decontamination system received emergency authorization from U.S. FDA, and they will supply not only the containers, but also the supplies and the trained staff, 7 by 24, so 23 personnel coming to North Dakota as part of this. And this will allow North Dakota to provide both the shipping to and from within state and N95 mass decontamination at no charge to healthcare organizations, EMS agencies, public health, public safety agencies, law enforcement, fire departments, funeral homes, dental offices, optometry, chiropractic clinics, and others. The way it's going to work, healthcare systems will collect those masks that are worn each day in accordance with the approved procedure. The PPE will be labeled with barcode serial numbers that will be used for tracking that PPE in a chain of custody. And this will ensure that each provider, whether you're a hospital system or a dental office, that you get your own respirators back because of the barcode system. And of course, what's going on inside these containers is exciting because they're using concentrated vapor phase hydrogen peroxide. It's been validated. They keep it at a concentrated level for 2.5 hours, decontaminates all biological contaminants, including the SARS COVID-2, which is the virus which causes the COVID-19 illness. And processing turnaround time for decontaminated respirators will depend on volume. It might take 5 to 7 days with shipping. So there'll be a little lag, but once we get going, we can turn those back around. This might enable as many as 3 uses for an N95 mask without degrading the filter performance. And again, this is in the capacity of these, they'll be able to do 10,000 masks per cycle in 2 cycles per day. And so again, we can move through a lot of masks. And just as a note, when the beginning of this, some mask purchases were being pricing was going up to $5 to $7 per mask. So at 10,000 per cycle twice a day, or $20,000 a mask, this could be decontaminating up to $100,000 of masks a day. And so again, tremendous savings for all of the people that need and will continue to need the N95 masks going forward. When we take a look at those, what this PPE decontamination system and match it up against our 8 criteria that we talked about last week, there's 2 of these that really this helps. Ample PPE availability was on our 8 criteria, as well as preparing for a resurgence, and having this capacity gives us the extra resilience and confidence that we will not be running out of PPE if we end up in a resurgence. Next topic we want to talk about is some updates to 2 previous state health officer quarantine orders. First amendment is to the State Health Officer Order 2020-0501. State Health Officer Mylyn Tufte is here, and this is going to be available for questions later today if there are questions regarding this. And this amendment reflects the new guidance from CDC updating the amount of days an individual must isolate after the onset of symptoms. And the previous CDC guidance was 7 days. That's been updated to now 10 days. And so this actually extends the guidance for updating the amount of time a person must isolate. And again, this relates to people who test or have tested positive. So this specifically relates to those who are positive and therefore would be considered active. To come off that, you have to quarantine for 10 days and then 72 hours after becoming fever-free with symptom improvement. So if you were at 10 days and you still had a fever, that doesn't mean you can get to go back out again. So it's an and, not an or. So onset of symptoms, 10 days and 72 hours after becoming fever-free with symptom improvement. So that's the first one. The second one, and again, that only relates to people that are positive. The second one touches a lot of people because this is is Health Officer Order 2020-02, which related to the travel quarantine order. I'm sure many will view this as good news. This allows for people to travel freely within the United States and releases requirements for people returning to our state, even from those areas that were previously defined as high outbreak areas, releases people from having to self-isolate or quarantine when they come back. The exception to this is international travelers. This is in alignment also with CDC guidelines for travel, and people commuting to and from North Dakota for work, essential supplies and services, even if it involves crossing an international border like from Canada, that is exempt from this order. There are other exemptions in there, so go to the guidelines. They're posted on the North Dakota Health website and for additional details. And while this amendment does this amendment to the travel quarantine allows for domestic travel, both CDC and North Dakota strongly recommend that North Dakotans limit travel to essential travel. So essential trips, essential errands, travel is necessary for a job that is considered essential or to provide medical or care to home to others. And if you are traveling, even around the state, always a good idea to minimize the number of stops. If you minimize the number of stops, minimize the number of interactions you have, the number of door handles you might touch, you're protecting yourself and your loved ones, because the less transmissible moments that you create or experience, the less likely that the virus is going to be able to continue moving. And so again, as we think about opening up travel, it's important to understand the North Dakota SMART guidelines to slow the spread still are encouraged by all, which again is washing your hands often with soap and water, or using hand sanitizer. Avoid touching your eyes, nose, and mouth, because that's how the virus can get into your system. Avoid close contact with other. Wear a mask or cover your mouth or nose. Certainly when you're coughing or sneezing. And again, those masks don't have to be surgical masks. Even cloth face coverings can be really helpful and disinfect and can clean surfaces. And so North Dakotans, you've been doing a great job on that. Keep it up. The virus is still in many states in this nation, still raging along. And so again, here in the good fortune that we've had both by geography and by the discipline of our citizens, we're in good shape, but that doesn't mean that it couldn't still show up at any time. So again, thank you for being North Dakota SMART. Next topic is the North Dakota Smart Restart related to NDDOT. And like all of state government, the North Dakota Department of Transportation is committed to safety, along with doing their part to help limit the spread of the virus. And as a reminder, earlier through an executive order, because we had to close in-person appointments in the offices where driver's license and motor vehicle tabs were due for renewal on March 1. Again, if they were due for renewal March 1 or after, they're still valid. Don't need to be renewed at this time per executive order. So again, if you've got a driver's license that expired after March 1 or a vehicle tab after March 1, you're still okay. And we're not changing that today because we don't want a crush of people rushing back in again to try to take care of those. And so again, remember that those are still valid. If your driver's license expired like last fall, it's not covered under this order. This is for only those that expired after March 1st. With that, today, North Dakota Department is announcing this North Dakota NDDOT Smart Restart will begin a phased approach to provide prioritized on-site services for driver's license and motor vehicle customers, which means we're in a limited way, phone appointment only, no walk-ins allowed. They'll start opening up again on Monday, May 11th. To schedule an appointment for services, call toll-free 1-855-633-6835, and there will be a whole list of things that'll be available, whether those are commercial driver's license, knowledge and road tests, H-2A for temporary ag workers, CDL renewal with hazmat, regular driver's license for Class D, work permits. Again, vehicle license expired before March 1st. So again, if it's after March 1st, you don't need to come in, you're still covered. But if it expired before that, or your license or your tabs did, come on in. If you're plus 65, need to get an eye test. We talked about that earlier. We're working and investigating a way to be able to do eye tests online, regular renewals, out-of-state transfers, motorcycle knowledge tests, ID cards for voting. TSA has extended the deadline for real ID an entire year. We talked about this earlier, but you do not need to come in for that because we're not accepting real ID appointments at this time. That's been extended till October 1st, 2021, and that was for being able to fly with a real ID. So no reason to come in for that now. Prioritized motor vehicle work services include title work for any type of vehicle, truck weight changes, large trucks. But I also want to note, I got a great message from former Governor Jack Dalrymple. Hi to Jack and Betsy. Dalrymple Farms was able to register a vehicle online on last weekend and was able to do that online without having to have anyone go into the DMV and sit and wait to register a vehicle. And I should make sure that that was not a new vehicle, it was a new used vehicle, because we know that Jack is very, he's very, how should I say, smart with his spending at Dalrymple Farms. So on that new used vehicle, they were able to do that online. He says that's the first time in his career they've been able to do that. So again, call the number if you've got to do something in person, but be sure to check the NDDOT website because more and more things are moving online. And also a shout out, Summer Schweitzer, who is, I believe, a teenager. I don't have her age exactly, but she had emailed me wondering during that time in your life, which is, hey, I want to get my permit and start driving. And Bill Panos has been back in touch with her, our head of NDDOT. One of the things that we will be offering when they open up by appointment is for people to come in and get set up to get their driver's permits, because that is also something that needs to happen in person. So again, thank you, DOT, for all of the work that you're doing. And again, but they're doing a lot of other things online. At nddot.gov, you can check out what's available for online. And a new one that's just starting right now, you can renew your commercial's driver's license online. Put it out there. Had the first online CDL renewal this morning. So again, innovation happening. And one of the things we know from chaos comes the opportunity to transform. And so happy to see that happening at NDDOT. So congratulations to the Director Panos and the whole team over there for making that happen, and also motor vehicle service such as license plates and titles can be done by mailing in the paperwork. Vehicle renewals can be done online or at a self-service kiosk or by mail. Motor vehicle kiosk fees for renewing your vehicle are waived, EA, until the emergency declaration is ended. And as I've said before, maybe we can just waive those permanently along with ATM fees. No, I'm not in charge of ATM fees, but but we'd like to see those waived. Okay, during this period, DOT staff will be doing the following North Dakota SMART guidelines. Same as before when we talked about the CDL stuff. Road test personnel will be wearing masks and gloves. Appointments, the seating lobby area has been reset up to keep people 6 feet apart, but hopefully there won't be people in the lobby because this is phone-in appointments only. Social distancing is going to be marked on floors. Extra cleaning will be in place. Customers, we've talked about customer COVID etiquette. When you arrive, if you don't have a mask or cloth covering, you may be asked to wear one. DOT will provide one. And again, I know some people may personally object to this or say I'm not wearing a mask, but again, you may feel that you're not at risk, but remember the person behind the counter may be living with someone or have a child or an older adult that they're caring for in their life who would fit in that vulnerable thing. So again, as a courtesy to all, if you're asked to wear a mask when you come in for any of these services, DOT will provide one, and thank you for your consideration of and helping keep all North Dakotans safe. And again, executive order 2020-06.5, access to state facilities is by appointment only. And so again, showing up is not going to work. You got to call and get an appointment, and we appreciate everybody's patience during this time. For the most current updates, go to dot.nd.gov. Next topic relates to CARE-19. We've received a lot of questions about the CARE-19 contacting tracing app. There's been a lot of news, both locally, nationally, internationally, about the CARE-19 because it was one of the very first apps that was out in the marketplace, and it was one of the ones that was most thoughtfully put together. Then about 3 weeks after it was out, Apple and Google, in a rare collaboration between two of the tech giants who have competing technology around Bluetooth, which is the generic name for being able to do wireless transmission in an area very close without using actually wireless, but using direct device-to-device transmission. That they were going to come up with a capability that they're going to add into their both Android and Apple, which they're calling exposure notification, which would detect when people come into proximity with someone who is tested positive. They, in the process of doing this design point that they've achieved or that are collaborating on as they work to this on the exposure notification involves that there's no data that's held centrally in any database. The idea is that then no government, no health organization, no entity, no company would actually be able to control the data because it would all be stored locally on your phone, and so the users would be completely in control. So this uses the Bluetooth technology, in which will be the integration between the two variants, the Apple and the Google, or the Apple iPhone, the iOS and the Android approaches, that those will for the first time actually work together. When they're coming out with this capability, it's going to, anytime you upgrade your smartphone operating system, it will include this. You'll have to turn it on. It'll be I'm sure a slider button like on iPhone that'll say, do you want to turn on your exposure notification? This in itself won't do anything unless there's an app to also work with it. So the CARE-19 team has been working really closely with Apple and Google, and the goal is to be one of the first states to implement their proximity technology. This would be called in the industry being a lighthouse application, and so I expect that you'll be hearing more about this. Apple and Google expect that they will only give what they're calling a golden ticket. I guess that's in the Charlie and the Chocolate Factory approach, but they're only giving one per state because they're not trying to create thousands and thousands of tracking apps. They want to have ones that are essentially have received the Good Housekeeping seal of approval by a state. And so again, North Dakota's intention with the Care19 app is that would be the one that would get our seal of approval with the golden ticket from Apple or Google. And it is a goal to be among the first to implement in the world to implement this new proximity technology. Care19 originally was designed around a total design point that included privacy. As we've talked about here before, it does not include your name, your phone number, your address. It assigns a random 36-digit randomized ID, but does use the location tracking capability. And so one should think about this as also extremely private application that you yourself are in control of on the side of Care19 that uses that uses the location tracking, but it can think about it as like a diary that can help you jog your memory. If you do test positive for Care19 and can't remember where you've been for the past 14 days, this would be great. The combination of the two, having a diary that automatically helps you remember where you've been and you're in control of that data, with this exposure notification or proximity capability, the two can really complement our contact tracing going forward. We're going to keep you posted on that. As you know, South Dakota has already adopted the Care19. I had a great conversation with the governor of Wyoming last night, and Wyoming is taking a look at it. It would be great if we could get a set of states in our region all adopting the same technology, and they could build right off that Care19 base. And again, meeting the combination of both privacy, which is our number one goal, and the ability to speed contact tracing. Those things matter because that's what's going to help us get our economy open. We've seen that from other countries around the world as well. Technology is going to be part of this solution as we live with this virus. Today, next topic is unemployment numbers. And for those that find this section numbingly full of numbers and nothing else, we're going to find a way to get these numbers posted online. So this will be the last day that I'm giving the readout of the unemployment numbers. But for Wednesday and Thursday combined, that was 1,026. So again, that's only about 500 a day. That's down. Wednesday and Thursday, pandemic unemployment 222. That's an old TV show, I think, for those that are old enough, room 222, but that's down, that's 111 a day. And then the Wednesday and Thursday pandemic emergency claims, 300. So good news, those are all dropping. The trust fund is still over close to $114 million. We have paid out in the state $196 million already, and that's $81.6 million through the regular unemployment. And that's reduced our trust fund, the federal pandemic emergency unemployment claims that have gone out, $110 million. That's the $600 kicker per week. $110 million have gone out to North Dakotans. And in the PUA, the pandemic unemployment assistance, is $4.3 million. Again, total regular claims since March 16th, closing in on 73,000, PUA closing in on 11,000, and PEUC about 12,000. So we'll continue to share that information online. But again, thanks to the job service team for all the hard work in processing all those claims. Next up is behavioral health update. In North Dakota Department of Commerce, in conjunction with many other state agencies, issued a statewide survey to understand how the coronavirus pandemic has impacted communities and individuals. The information gleaned from these 11,300 responses will help inform many state agencies and partner organizations, North Dakota's effort during this time. Survey respondents reported a number of concerning trends. Since March 15, top concerning situation was identified as increased mental health struggles. 68% of the people reporting this concern. Over half the respondents report that high rates of social distancing are impacting mental health in those in their household and others in the community. So behavioral health, again, continues to be a key focus that as we move forward. The Department of Human Services Behavioral Health Division has compiled a list of behavioral behavioral health resources on their website. They've also expanded access to telehealth services. So again, if you need to talk to a counselor, if you're just feeling anxious, if you've got concerns, there are multiple different hotlines staffed and available 7 by 24 hours a day. And you can find out information about all of those on the nd.gov/DHS website. And then also there is more information available about what we're offering through our service center locations around the state. So again, thank you for keeping track of your own and your other family members and friends' behavioral health. Take it seriously and help guide people. Care enough to help guide people to get connected with health. It's one way to show that you care. Next topic has to do with gratitude and good news. And the first piece, we've got a lot of recognition weeks and recognition days to click through, but the first one seems very fitting because the first full week of May, which are just wrapping up right now, is Public Service Recognition Week and honor the men and women who've answered the call to serve communities from the local to global level. So again, we want to say thank you to all the countless public servants that work at the city level, the county level, the township level, whether you work in health or law enforcement, you're a public servant. Also to all of our elected leaders that are working in those local levels, we say thank you as well. We've got tremendous gratitude. The unsung heroes who do the work and keep the programs and services going to help people stay safe, healthy, and productive, and let's make sure their tireless efforts do not go unnoticed. We also want to particularly give a shout out to all the many team members of Team MD who've put in countless hours of adapting, ramping up, creating new programs and services. And whether that's, again, whether a job service we just mentioned, our incredible Department of Health, the National Guard members, the Human Services team, Emergency Services team, so many agencies doing so many amazing things across the state. So thank you to all of those public servants today and every day for all you do on behalf of North Dakotans. Turns out this is also Corrections Employee Week. Again, they're part of those public servants that we want to honor, and we want to give a special shout out to our corrections team member while working to keep our residents and communities safe and healthy while supporting successful reentry paths. I do want to thank our Director, Department of Corrections and Rehabilitation, Leanne Birch. She and her team have done a fantastic job through this, and the old adage, knock on wood, we are one of the few states, I've been up here over 45 times and I've yet to report because we have had 0 positive cases of any residents in any correction facility in North Dakota. That is a rarity, and I credit a lot of that to early actions taken by Leanne and her team. And because of this, we've been able to divert resources to other locations. That doesn't mean that you can keep this virus out forever, but it does mean that we've had 5 or 6 weeks to really prepare and get ready and put new practices in place. And this is fantastic. And I do want to say we talk a lot about wearing masks. I did report earlier that we did have one corrections team member about a month ago that was tested positive, but that person was wearing a mask at work and they tested everybody in the facility and there were no positives among residents. So masks can really make a difference. We were probably 1 mask away from having an outbreak like some other states had. So way to go, North Dakota Corrections team at all 5 of your locations. Today is also Child Care Provider Appreciation Day in recognition of the thousands of child care providers and teachers and educators of young children everywhere for their hard work and dedication as they help nurture, care for, and challenge our children. And of course, many of these child care providers have kept on going, never closed their doors, kept serving the children of essential workers through all of this. So again, Child Care Provider Appreciation Day, we do appreciate you. And we've talked about military families before, but today is Military Spouse Appreciation Day. And as we think about the thousands and thousands of military members that are serving in active duty here in North Dakota, whether it's in Fargo with the Happy Hooligans or at Grand Forks or Minot Air Force bases, but we also especially think of those over 300 National Guardsmen who've been called up and have been working around the clock on a 30-day assignment here during this. As we say, when one person serves, the whole family serves, and we want to thank all the spouses who play critical roles supporting their spouses, but also when their spouses are called to duty, that they're taking on even more responsibilities at home. So again, without the military spouse support, we wouldn't have the great National Guard that we do in North Dakota and the great military we do. And of course, as I open today, Sunday is Mother's Day. Parents across North Dakota have been stepping into new roles. This year, we want to especially recognize mothers, and whether it's through foster care, adoption, birth, or you've just taken some young person under your arm and are and acting as an important adult in their life, we want to say thanks to all those people who are in either mothers literally or in the roles of being mothers who've helped shape and are helping shape North Dakota children into responsible and caring citizens. And so when I close with gratitude today, I want to share a quote from Albert Schweitzer. It says, "At times, our own light goes out and is rekindled by a spark from another person. Each of us has cause to think with deep gratitude of those who have lighted the flame within us." And I would say with that thought, because there have been times when each of us may have been struggling or tired or exhausted or worn out, and somebody else rekindles us with a spark of gratitude. This is an opportunity for this weekend for us to take that time and rekindle somebody else's spark. And a great place to start would be sharing our gratitude with all the mothers across North Dakota, the mothers, the grandmothers, the great-grandmothers. So again, thank you, and we'll stand for questions. We're going to go online first, and then we're going to come right down the line.
Robin Travers, 660 KYZ in Williston. Williston Mayor Howard Klug has I'm sorry if I mispronounced that.
Mayor Klug.
Called us wanting clarification on guidelines for banquet halls now opening to groups of 100 or more. What rules will they be required to follow, considering serving food or hosting activities such as dancing?
Those are still closed, the large group gatherings, and we indicated here earlier this week that we're targeting next Friday for guidance on what we do with large group gatherings. And now when I say that, I mean if you're have a space where you're following all the guidelines for restaurants within that would be possible. But the way I was hearing the question, I was hearing that it was going to be a banquet of 100 or more with dancing, which would also be in the close proximity category. But I'm sure we got a lot of wedding dances coming up that people are thinking about. We're going to take another one online, because I know there's actually more people online than there are in this room, and we've heard from them that they don't feel they get their share of questions. So we're...
April Baumgarten, the former Fargo Moorhead. The Care19 app has received reviews that it isn't recording accurate locations or not working. Why has the app been so buggy, and is it okay for the state to be relying on this app for contact tracing and making decisions?
The answer on location is that it's getting better with each release, and there's variance between the Android platform and the Apple platform in terms of the accuracy. But I would just say, again, for those people that are using the app that are having a good experience, that's great. Those that find that they've got location errors, they should pass those on to the developer. And I believe there's a way in the app where you can provide that feedback, or we can post that. But it's the Proud Crowd is the name of the developer, and people could give feedback to that organization. As far as us relying on it, I'd say we're not relying on it per se. This is a tool for individuals to use. The state itself is not relying on the app. The state is encouraging individuals to be able to use this, again, in its current form as a diary to help you remember where you've been if you get contacted by a contact tracer. And in with the new Apple Google technology on the exposure notification, that'll create even more functionality down the road. Apple Google is still weeks away from releasing that. So again, we would encourage people to download the current app. The more users we have, the more feedback the developer gets, the better and the faster that app will become, and the more useful it will become. Okay, we're going to go to Lane, and then Dave, and then Jacob. Okay.
Governor, over the past few days, we've had results from over 2,000 tests each day. Now today we're back down around 1,600. Have we caught up with that backlog? Is that the reason for the lower tests, or has other problems arisen?
It's a combination of the two, which is we are completely cleared with the backlog that we reported on Wednesday. We still had 1,800. Those have all come through. But we did have one of our M2000 machines that had a breakdown. We've flown in an Abbott technician. They're on site right now. They're working to get that back up again. And so that is should be back up, and we should be at full capacity for test capacity tomorrow. I would also, again, encourage people to get tested if you're symptomatic and you think you need to get a test. There seems to, again, still be some confusion that you can't get a test unless the state of North Dakota shows up and does a large-scale drive-through testing. We want everybody who thinks they need to get tested to contact their provider, talk to them about getting tested, because if we don't have demand for more than 2,000 tests a day, we're not going to have more than 2,000 tests. And so we really need to have people that are being proactive about going out and getting tested if they need to be. Our outbound testing, as I've described, is going to become more targeted. A lot of that's going to be around vulnerable populations. So we'll still have hundreds and hundreds of tests being taken a day, but those are going to, for the near term, will likely be more centered around long-term care and people that work in long-term care, or the close contacts identified of the positives. But given that, like today, where if we've got 50 to 54 cases that are in Cass and Grand Forks County, and we may identify 6 per person, we may identify 300 people that have been in close contact with those 50. We're going to try to monitor or get those individuals tested at the appropriate time. We'll keep doing that, but for the rest of the state of North Dakota, even if you're in an area where there may be declining or low numbers, if you're symptomatic, we encourage you to get tested. Dave?
If I remember what you said, Governor, the rate of positives to tests is about 8% in Cass County?
8.3.
8.3. Why is it so high in Cass County? Are there reasons for that?
A lot of it has been concentrated within long-term care and long-term care workers. And then the other reason why we think it's high is that even though, there's a lot of attention given the fact that we did hold some successful weekend mass testings, we've done actually less testing in Cass County per capita than we have in other places. And generally, when we do more testing, then the rate of positives tends to go down. So we want to get our testing rates up, even as we're being targeted about who we're trying to hit.
So just as a follow-up, then will there be some perhaps events in Fargo in the next week or two?
There's going to be a very targeted testing plan, but again, we have a high concentration of the 218 long-term care facilities that are in our state. We've got a large portion of those are in Cass County, and they're in Cass County, and then they're also large facilities. So then they end up having a large number of workers too. And so it is a place where we know from the rest of the nation that outbreaks can occur, and they're hard to control. But if you've got someone who's working in a long-term care facility who becomes positive, but we didn't catch that, and then they go home to their neighborhood, their family, then that becomes a challenge. So it's one of the things where we've got to work extra harder on the contact tracing in Fargo. Jacob?
Governor, the 14-day rolling average has been decreasing for some time now, but the daily positive rate has been on a steady uptick for most of the month. Should the daily positive rate play more of a role in which restrictions to lift, or has it played more of a role?
No, we have to look at the 14-day average. I mean, the daily positive rate is interesting to us, and we pay attention to that. But as I've just, in my answer to Dave, it can change. If we do a mass testing and a lot of people that show up are the nervous well, we're going to drive the daily rate down. If we do a better job of identifying people who've been in close contact with positives and invite them and get them tested, then the positive daily rate's going to go up. And so I think, again, it's helpful for us not to overreact to any one particular day, particularly when there have been some lags of when these tests are coming through. So it'd be more helpful for us to look at the 14-day average. That gives us a better sense of the trend.
Governor, it's not necessarily a one-day situation. It's been a trend line that's been positive for most of the month, not necessarily a one-day overreaction.
I'm not tracking that because we were at, over our 14-day average. I know we can pull that slide up again if we want to, but the one that we're using, I think, reflects, this slide reflects all the tests as a denominator, all the positives, as the numerator over each day, the 14 days previous. So on 14 days ago, 6.4% of all the tests taken in that 14-day period prior to that were positive, and then each day forward. So now in the last 14 days, the 14-day rolling average of all the tests we've taken in the last 14 days, only 2.8% have been positive. So we've actually, I guess I'm rejecting the thesis in your question, because the data I'm looking at shows that this rate is actually going down. Okay, I'm going to go online, 2 more online, and then back to Lane.
Matt Henson, WDAY. Simplot today asked for the state to hold a mass test event for the plant. Do you plan on helping them, even after they had refused to participate in the first one that was held?
I'm not up to speed on any prior offers or refusals, but if we have large manufacturing plants that want assistance on testing, we want to collaborate with them and figure out the appropriate plans to work with them. So this is one of the areas, whether it's, as we've seen in other states, and as we've seen in our state, one of the places you can have large outbreaks is in large manufacturing facilities, and whether that's food processing or manufacturing. And so along with long-term care, we view those as populations that can be vulnerable when they're in close working conditions. And so we want to make sure we're working, because we want to work with everybody to slow the spread of the virus.
And then you may have touched on this. Gene Schemp, Hometown Radio Group. Will appointments for motorcycle permits also become available with the ND Smart Restart, or NDDOT Smart Restart?
The answer to Gene will be my shortest in 45 days, yes. Motorcycle tests are available. Okay, Elaine?
Governor, earlier you talked about, when you answered the question about the large gatherings at the events and whatnot, this weekend with Mother's Day being on Sunday, a lot of families might be going to church. Do those churches also fall under those guidelines, or is there separate guidelines been issued for them?
Churches were never closed, and so we didn't offer any guidance because they were always able to be open. We encouraged people to choose alternate methods and to be sensitive based on the sort of the demographics of their congregations. If it, again, because knowing that this disease has got more risk for people that have underlying health conditions or are elderly. And we saw great voluntary participation and some really smart, innovative approaches by faith-based groups. I think one of the things that we're seeing, if you've got a family group that's been either living together or has already been in contact with each other, those groups sitting together in the same pew, same as if they were sitting together at home, that's great. We've seen a lot of churches, they've sort of closed off every other pew, and then asking family groups not to sit within 6 feet of each other. They've stopped passing offering plates, the passing, the handshaking, the greeting of the peace with each other. So eliminating those parts of a service that could increase risk seems to be very smart. Of course, all of this is voluntary, and we are again so grateful to all the faith-based leaders that have been really looking out for their congregations and finding new ways to approach it. And we've got through all these weeks with almost zero complaints statewide. So I'm sure that the faith-based organizations will continue to operate in a smart way, because everybody wants to have a safe and healthy Mother's Day celebration. And I think no church wants to be a headline because they're the center of an outbreak. And again, this could be a school, a bar, church. Any of those are all potentials for us going forward. And I think, again, everybody wants to take care of their, whether it's your customers or your congregation. We think there's a lot of responsible leaders in the state, and we're confident in them. Dave?
I've heard some people talk about the potential for having some kind of bogus tracking thing, like a scam. Have you heard anything that there might be some people trying to develop that? Have you had anybody complain about something that looks like CARE-19 but is not?
Haven't heard that. I mean, I think this is one of the reasons why Apple and Google want to only offer what they're calling the golden ticket, because if you go on any of these app stores, if there's a hot app category, then if there's one hot app, then the next week there's 20, and the next week there's 200, and everybody's throwing up apps. But these apps that relate to CARE-19 and are getting the opportunity to use the exposure notification that Google, Android from Google and the iPhone system from Apple, they're going to give one per state. I mean, they essentially want even though none of the data is held by the state, none of the data is available to the state health department, they want to have a state give its approval that that's the official app, because they want others to sanction them. And that's unusual because, a lot of the app, out there, I want to say it's Wild West, but it's wide open, it's competition, proliferate lots of alternatives, usually a good thing. But in this case, they're being very careful about that, about what's official and what's not. So it should be very easy to be able to tell if an app does not have the support of the official organization, even though that organization, I repeat, would never have the data. I mean, in the Google Apple piece, the location proximity never leaves your own phone. It never goes up into the cloud to somebody else's server, so it's completely private. Andy, I don't want to miss you over there. If you're out of line of sight, you're all good? Okay, thanks for coming. Okay, we're going back online.
Dave Kolpak with the AP in Fargo. Can you comment on why you think the unemployment numbers are going down?
I think two reasons, Dave, why I think they're going down. One is because people are getting, those that had to close or voluntarily closed are opening back up. And I think that's number one. I think the other thing is we know that the first wave, almost the first half of those numbers were all related to the oil industry. And I don't want to say that that there's nobody left more to lay off, but I mean, the loss of jobs in northwestern North Dakota over a period of a month was really substantial. And at some point, we do run out of people that are also going to be laid off, because you get down to sort of a floor or a minimum. Happy to see that yesterday oil prices, topped $24. Lieutenant Governor Brent Sanford and I were saying, I mean, who in the world would we ever have thought looked at $24 for WTI and said, that's a good thing? I mean, that's sort of an impossible thought, but when you're coming from negative 37 and coming from single digits, it looked pretty good to be at that level. But that's not a high enough price to get the wells turned back on again. We're gonna need to see higher prices than that. And so one of the things that you need to get the wells turned back on is you need oil field services workers to do that. And one of the things that we're going to be taking a close look at with the CARES Act funding is what can we do to support that particular segment of the economy? Because if we don't have the ability to turn the wells back on, that's really hard. It's hard on our communities, hard on employment, hard on companies, hard on North Dakota tax revenue. So that's one of the things that we're really going to zero in on in the next week. Okay, are we at the end? Unless there's other questions here? All good? So listen, I want to say again, thanks Mylin and your team, Tim and everybody that's here. Congratulations on getting the Patel system up, and appreciate all the work that went into that. That's exciting that we've got the ability to recycle those N95 masks in a decontaminated way. And I want to thank everybody for dialing in today. Thanks for being North Dakota Smart. If you're traveling this weekend, travel safe. Again, North Dakota Parks opening up this weekend. Call ahead or check the North Dakota Parks website to see what services are available, and practice your North Dakota Smart guidelines even when you're in the great outdoors. And again, happy Mother's Day to all the mothers across North Dakota. Take care, and we'll see you Monday at 3:30.